So the medical industry has actually been somewhat left behind, especially the surgical specialties. So healthcare has gotten their fair share of electronic medical records, and almost all of them have taken a physical paper chart and done a digital representation of them.
You want to enjoy what you're doing. You're spending more time with your EMR than you are with your wife or your husband. You're spending 8 to 10 hours a day on it. And so many physicians, when they implement an EMR, you hear the horror story of staying up till 9 o'clock or 10 o'clock at night after you're done seeing patients, typing in all of these notes. You don't want to do that. You want to be done when it's 5 o'clock and you're done. You want to be out the door.
And so very little software today exists for surgical specialties like dermatology, optometry, ophthalmology, orthopedics, and so on. And so it left a pretty big hole in the market for a company to come in with a very specialized system that could speed up those doctors, that understood the medical domain, because we have a huge panel of subject matter experts who come in and teach our system the medicine. And so instead of it having to adapt from a blank slate to learn everything you'd want to do, the system comes out of the box with this wealth of medical information.
A lot of medical records, electronic medical records, take a lot of work on the doctor's part, and on a daily basis they see less patients because they're not as efficient with the electronic medical record.
So the application today runs on any browser, so it can be accessed anytime, anywhere, really on any device that has a browser, which is almost every device today. Then we built a separate application just for the iPad. If you think about the iPad, it's all-day computing, it's touch-based, which we had built everything for touch. And when you build for touch, you get all the benefits around, identifying big, easy-to-touch buttons on an application, and you minimize the amount of clutter on the screen. And so then it doesn't matter if you're touching with a finger or you're clicking with a mouse. You've got a very clean, very intuitive user interface that allows that entire experience to be very smooth and seamless.
It knows and understands dermatology and ophthalmology. It has the knowledge of a 2,000-page textbook, but it only shows you what you need to see when you need to see it. So the art of using it, it's as simple as, touching a couple things on a touch screen. It's almost like working the cash register at McDonald's. It's a Big Mac, fries, and a Coke, and yet all of this wonderful medical knowledge comes out and is beautifully displayed.
EMA Ophthalmology allows you to be as efficient very quickly, and with the adaptive learning that EMA Ophthalmology has, it will learn that specific doctor's ways of practicing. It is amazing that you can start picking up the product, and even though the product doesn't seem that it was made for Dr. Smith, in a few days it'll know the practice patterns of Dr. Smith and therefore get his practice patterns or her practice patterns and make it faster on a daily basis, which is amazing. The adaptive learning process is amazing.
There are a lot of companies out there, but ophthalmology is a very special niche in medicine. And there are a lot of EMR companies that have taken EMR built for internal medicine and tried to retrofit it and make it for ophthalmology or other surgical specialties. And it's a lot like putting a round peg in a square hole. It just doesn't quite fit. And this is really an EMR that was made by ophthalmologists for ophthalmologists. And there are a lot of unique aspects that I think make it different than anything else in the marketplace.
For the EMA Ophthalmology app, I love the ability to draw. We've invented this new technology called ophthalglyphics, which is able to position a drawing or an icon exactly where it needs to be on the fundus or on the slit lamp on the cornea as well. And instead of drawing and sketching it out, which doctors do, it just knows exactly what they want, where they want it, and it stores it. I think that's uniquely ophthalmology, and it's beautiful.
Building these things is fun. I mean, building a product that people love. We have these buttons we give away at conferences that say, "I heart my EMR." Nobody loves their EMR, but people here understand that we can save them time. Our users tell us that they're saving an hour and a half, 2 hours a day. We actually had to go back to some of our users and say, in the testimonials you gave us, these aren't going to be believable. No one's going to believe that you used to leave at 6:30 and now you're leaving at 4:30 and you're billing at a higher level now because the product is picking up all this stuff that you weren't previously billing. So we've actually had to go back and tone down the marketing from reality, which is the opposite of what you would normally expect in a software company.
EMA Ophthalmology is a company that was started because there was a need for a better electronic medical record. And in the end, it is a company that is about the doctors that it serves. It's not a company that is in a headquarters that they're just there to collect fees. They want to make it better for the doctors that they serve so that the doctors can practice more efficiently and treat patients in a better fashion. And I think that's the main mission statement of the company, is to make an environment better to practice medicine, ophthalmology.
What makes the people of Modernizing Medicine, the right team? Why is this the right team for the job? The answer would be that we have surrounded ourselves with people who are immersed in the technology and who are immersed in the medicine. So all of our trainers were either medical assistants or PAs or worked in a hospital in the field of practice. So they come from, in the case of dermatology, the dermatology market. So when you pick up the call, when you pick up the phone, and you talk with our sales reps or our support team or our trainers, they really know the domain. We're doing the same thing in ophthalmology, we'll do the same thing in orthopedics. We're bringing in people who understand the specific needs of all those disciplines. That, combined with a passion for transforming an industry and making it better, make this the right team to build this technology.